Absolutely.
Thank you.
Okay, wonderful.
Okay, so thank you both for joining us. We are going to get this started. So hello, on behalf of the MPA Student Association and ICMA at Pace University, we welcome you to tonight's topic of public service careers amid COVID-19, how to exercise effective leadership. My name is Sydney Moratis. I am the current Vice President of MPASA, and today is my President, Monet Moradi, the President and Vice President of the ICMA chapter, Nino and Khalid Nixon. And Dr. Skutelniku, the chair of our department, is here as well. Today's program will consist of questions for the guests in attendance from us and the student body. We are honored to have here today Ariana Anderson and Patti Dwyer with us as our alumni guests. Ariana Anderson is currently an administrative manager with the U.S. Department of Veteran Affairs, with a focus on the clinical practices in the department. And Patti Dwyer is a former village manager in Walden, New York, and is currently the founder and owner of Source Municipal Solutions, LLC, a consulting business established in 2017 to serve New York-based public and private sector clients. And with that in mind, Nino will introduce our panelists. Thank you.
Nice to meet you, and thanks to our guests for their time and for the participation in this evening. I'm very pleased to introduce our panelist. Ariana Elizabeth Anderson is currently an administrative manager with the U.S. Department of Veteran Affairs. She oversees fiscal, contracting, and logistic operations, as well as clinical scheduling supervision. Ms. Anderson earned her bachelor's degree in health science from Stony Brook University in 2007 and Master's of Public Administration from Pace University in 2010. Patricia Dwyer is a founder and owner of Source Municipal Solutions. Prior to launching Source Municipal Solutions, Patti was employed as a professional municipal manager. Her responsibilities included facilitating and implementing governing board policies, directing and supervising municipal operations. Mrs. Dwyer obtained master's degree in both accounting and public administration from Pace University, as well bachelor's degree in sociology. Patti has also been employed part-time and adjunct associate professor at Pace University. She lectured on graduate level, specializing in courses such as intergovernmental relations, organizational theory, municipal management, and public administration. So this is not an exhausting list of our guest career achievements. So to start, each of you, please, could you talk about your career?
And I think in the interest of time, I think we should get to the questions.
Sure.
Yes, of course. So if guests are okay to move to the questions, or if they want to add about their career achievements, which I haven't mentioned, they're welcome.
I'm happy to go into the questions, and I'll fit my experience in there too.
Okay, great.
Great. So our first question is, we'll start with Ariana Anderson and then ask the same of Patti. What is effective leadership? Can you provide any good or poor examples of leadership, either on a governmental or organizational level through COVID-19?
Sure. Thank you so much again for having me tonight. I would say effective leadership is leading by example. You have to set the tone for your staff, and you have to make the vision of your organization clear from the very beginning. As a manager, it's our responsibility to ensure that our staff have all the tools necessary to do their work and make them feel empowered to do their job and their function, and always remind them that we are a team together. We might be the leader of the boat, but we can't get anywhere if we're not steering the ship together. So it's important to always ensure that that teamwork always exists. And there's also transparency. making it very clear what the vision is, being available for your staff. If there's any problems, letting them know that it's okay, it's a safe place to come and speak about what's going on so we can fix the problems in the beginning and not wait to become huge problems later on. And that was extremely important during COVID, because in the beginning, it was a frenzy, especially in the healthcare center where I work. We had no idea how to tackle this. And we were all trying to figure this out together while staying safe and, quite frankly, staying alive. So it was more important than ever to remind each other that we are a team, and we have to be here on this site together to make sure that patient needs are met first. And whatever other issues that we have, we will deal with them later, but identify the root of what we're trying to manage up front. So overall, that's what I would say. Lead by example, always acknowledge that you are a team, be very clear about the vision in the very beginning, make your staff comfortable to come to you, and always remind them and keep them focused of what the vision is.
Patti, same question.
Sure, thank you. And I also appreciate the invitation to be here. Can you all hear me well?
Yes.
Okay, great. So, putting this in the context of dealing with a pandemic, as someone who is either managing or leading an organization, is a pretty interesting question, because effective leadership means that there's something that essentially is measurable to determine whether or not it's effective. So when you deal with something like a crisis, at least in my experience, it changes the paradigm, requiring a leader not only to be experienced, but able to behave and have a proper mindset in order to reach whatever the organization's goals are during this type of unusual management circumstance. So effective leadership during a pandemic really requires, I think, behavioral attributes and mindsets in order to lead an organization to successful goals. And effective leadership is nothing more than, a series of actions that either allow people or organizations to reach their goals. So how do we get there, in crisis? And what type of mindsets and what types of behaviors are necessary for leaders to be able to demonstrate? There are probably a few things that come to mind, and I think Ariana experienced these as well, being on the healthcare, front of a global crisis that has not been seen in over 100 years. One of the most important things in terms of attributes would be having a deliberate calm, meaning that the person who has to demonstrate the capacity to lead an organization or to attain some goals has to be able to do so under extreme stress and duress. So you would want to see effective leadership, someone who has the capacity to be deliberate and calm, and also have some sort of capacity to be optimistic, and to keep people motivated, because we all know that during these times, one of the most difficult things to do is to keep people focused on, their mental, physical, and just their familial well-being. So, leaders have to possess a lot of different attributes other than experience in order to get through these types of situations. A little bit of empathy, certainly, the capacity to communicate effectively, and also, to be able to delegate and to be able to trust, resources that you have available. So I think that's how I would answer that question. What would determine to be effective leadership?
Thank you so much for your exhaustive answer.
Sure.
So can I move to another question? Or do you have any other questions regarding or any additional comments? Okay, so So do you believe your organization or agency is distributing equitable service delivery to its minority and women clientele during COVID-19 and transitioning to endemic? How can leaders in public service address disparities and solutions?
There's a lot, maybe I'll start with that question. There's just a lot to be said about equity and inclusion and public services. There has been, I believe in the last few years, very disruptive behavior in the social systems in this country. And we've seen, for the good, I think, amount of time, a sea change in people's thinking about where we need to put resources in order to bring equity into our economic systems, our social structures, our capacity to educate, and our ability to govern. And I think that the public sector has always been able, and not easily, but has always been able to move that ball forward. I think that's why I spent a great deal of my career in the public sector, knowing that, we can make some incremental changes. We can't do things as revolutionary as we may like, because systems are very, the architecture is just not there for the flexibility or for the creativity. But we can still try very hard to bring, some of our social systems in line to create more equitable situations, especially for people in the BIPOC population, Black, Indigenous, and people of color that have historically and systemically been, on the other end of the spectrum when it comes to dealing with service and equity and inclusion. So, I think that we've got opportunities. I see things changing. I'm happy what I see. It's a brave new world. It's a lot different than, it was 2 years ago, a lot different than it was 20 years ago. It's getting better, but it's painful. I have to say, it's been a painful march toward progress. But, I think that we need to keep the light on these issues. We need to keep socializing and communicating, and we need to keep the pressure on, the pillars of our societal foundation that can make structural changes, whether we're dealing with laws, whether we're dealing with policy analysis, the data, and just the social engagement of people. Those are the things that we have to focus on in order to bring equity into our systems. Thank you for the question.
Thank you for your answer. Thanks.
Patti, I'm curious about what opportunities specifically are you seeing?
I've not, I have to say I'm not on the employment end as much as I was in the past. So it's a little difficult for me to respond to that directly in terms of opportunities, but academically, I've done some research and I'm seeing things happen, like in the city of Rochester. They've just done an amazing study on racial and structural equity in that city. It was in response to a police shooting that took place a couple of years ago when they had an incident that ended up being, creating a lot of racial tension in Rochester. And they've come to the table with a number of opportunistic changes that if they do make them, they will be able to open up some of the structural systems that in the past were not accessible or easily accessible to people who were either racially or otherwise economically disadvantaged in that community. Now, maybe it'd be helpful if I had an understanding of what what the experiences have been, from maybe from the lens that you're looking at this question. What prompted the question maybe will help me, maybe give you a better answer as to what I'm seeing going on, in at least in the communities that I'm working with. Right now, I have probably 80 municipalities that I'm working with as an executive director for, local governments in the state. So, can you speak more to the issue and perhaps?
Well, I think just as like personally, I find that it's hard to know like where to tackle, because I am on the government track, but I'm also looking towards healthcare. And from what I'm hearing just from the daily emails I get, local government seems to be where the direction is heading. And your answer kind of like gave credence to my assumption.
Okay. And you're saying local government heading that way for just to break down some of the
Opportunities.
structural, right.
Yeah.
Yeah, I think that's where the answers lie. I mean, the answers lie in some of the pillars of society. Like I said, you have to get to the laws, you have to get into the policy analysis. You have to take a hard look at data to make sure we're doing fact-based things and we're focusing on the right places. But civic engagement is really where, we are going to be able to continue to make, great strides, have painful conversations, but keep things open and can keep things honest and transparent and informative. I think that's the only way forward.
And Ariana, I want to kind of see if I can identify any opportunities. Have you noticed any opportunities, just because yours is healthcare, which is different from the government track?
Sure, absolutely. So as I heard the question, it was in regarding to delivering equitable
Yes.
resources and services.
Right.
So I'm looking at it from I guess a patient perspective. And I would say that, yes, the Bronx VA Medical Center is making great strides in ensuring that services are equal to women, to people identified as minorities, to Black people. But it really always starts, I would say, with proper identification of who we are treating. And what I mean by that is, with the transitions of people identifying themselves as different races, different ethnicities, different genders, different sexual orientations, it's important to start with the individual and ask them first, how do you identify yourself? Because then we can know what resources are best for you as how you identify. An example is, part of my position is I review a lot of clinical information and data from patients. And I would notice that in the progress notes of some providers and patients, that some patients were identified by ethnicity. So say, for example, 28-year-old African-American man or 27-year-old Hispanic man. But then I would see something that would say 35-year-old man. So then when I would look at the demographics, I would notice that the man was white. So it became apparent that it was important to identify those who were non-white as whatever their ethnicity was perceived to be, but not for the white patients. And I feel like it should be equal across the board. But I also asked some of these providers, did you ask the patient how he or she identifies? Or did you just assume by the way they look that they are this? And the key is, if you're going to identify it, ask them how they identify, because it could be incorrect. And you'll already have a perception of who you're treating that might be incorrect from the very beginning. You might assume that because that person is a certain ethnicity, they might come from a certain socioeconomic status, which might be totally wrong. You might think that they're from a certain country, you might think they come from a certain thing, speak a certain language, have a certain religion. You have to ask them from the root, and then you can start to identify the resources that might be best for this person. Another change that took place in the VA is that now we can all change our emails to identify the pronouns, whether it's he, she, they. Same thing with patients and their demographics. Now they can identify their birth gender, and then they can identify what they identify as now, which I think is really great. So in order to identify how you can treat, you have to identify who you're treating and what their history is, what their current socioeconomic status is, what their mental and psychological status is. Then you can get to the root cause of how you can help them. We have several services for women, women's health. We have a diversity and inclusion group in which we encourage everyone to be a part of, regardless of their background, as employees, but also they can talk about different issues that they might be having to connect with their patients. And that's their opportunity to also identify resources, not only in the VA, but also in the community that can help their patients. So there is a lot of resources now. And a lot of wonderful awareness, I would say, to really identify people by asking them, and then you start from there.
Mm-hmm. Thank you.
You're welcome.
Yeah, it sounds very similar to like kind of things what I'm learning in class right now about, the doctor-patient relationship. So my final question is, before we.
I have, it's okay. I have a question for Ariana. It's regarding this setting. I was having a class of public economics in healthcare. And so I faced the same problems, like when going deep to the healthcare problems in the United States. So I'm a foreign international student, and I'm just getting familiar with all these issues and topics. And so I was wondering about these healthcare problems. So even the huge part of the budget is spent on the healthcare, still the half citizens or more are not covered by the health insurance. So do you know, or how can you explain why it is happening and why the healthcare system is so expensive and not affordable for the citizens, for all? Since we are talking about equitable distributing of healthcare systems, why it's happening that not all population citizens aren't covered and still they're experiencing these problems?
Oh, well, thank you for that question. It will require a very complex answer.
Very complex.
Definitely. So from the VA perspective, all patients who've served in the military are all eligible for healthcare there. It varies for some patients. If they're 100% what we call service connected, meaning that they've sustained injuries that make them totally disabled, they're eligible for many more services than those who are service connected for less. So from the VA, we do our best to make sure that our patients have a very holistic and inclusive healthcare when they arrive. For the general public, I could give you many reasons. Many of those are socioeconomic. Many, even people's zip code sometimes determines what kind of healthcare they will receive. Their finances, their economic background, their race, their ethnicity, that all plays a major factor, especially in this country where there have been specific systems put in place to ensure that certain services were denied to certain people. So the goal is to understand what the barrier is. And again, proper identification, identifying those who are not receiving the services that they do deserve and figure out what that barrier is. Is it because of where they live? Is it because of their jobs that they don't offer health insurance? Is it because they don't have the education to get the job that offers the health insurance? It can be a very multifaceted response. I think that would really require to do a deep dive analysis into which groups are underserved and then tackling it from there. But from a VA perspective, I can say that our goal is to always make sure that all of our veterans receive the most optimal health care that we can provide. Again, whether they're male, female, regardless of their race or their gender identification, we offer everything there: mental health, primary care, women's health, cardiology, everything, social services, even patients who are homeless. And those are if they weren't veterans, those would be the demographic who you'd find homeless on the street with absolutely no services. But because they serve the country, they're eligible to at least get the first step of foundation, which is housing. And we find that once they have housing, then we can focus on the behavioral issues, the psychotherapy issues, the medical issues, because if someone's homeless, they don't care about any of that. They're just trying to find a place to live. So that is a problem as well of, chronic homelessness, and that being a barrier as to having adequate health care. It's multifaceted. That's a wonderful question, though. But I think it would require, again, deep dive analysis into specific demographics and populations who are feeling underserved.
Thank you so much. Thanks.
Feeling on it too. Oh, you're welcome.
So in the interest of time, we're going to move on to any rapid fire questions that anyone who's watching has. Just raise your hand and I'll point to you. If no one has, I can move on to the third question. So 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 I'll start with Patti because this is her current field. What public-private sector jobs do you believe will increase or decrease in relevancy within the next 5 to 10 years? And how can leaders advocate for employment and equity, employment equity in the public sector?
Yeah, that's a pretty good question with respect to future job outlooks. I mean, we kind of had a handle on that because we saw, as they were saying, that what they considered a silver tsunami come in the public sector, people my age and a little older bailing out because we're aging out, or we've just gotten to a point where, you know, we are the end of the baby boom. So lots of jobs are opening up, lots of, talent lost. A bit of a brain drain in the public sector. So I do see a tremendous amount of opportunity in local government administration and management. In this country, there are 88,000 local governments. So when you look at your MPA degree and you think about where you're thinking to focus, there are considerable opportunities and points of access throughout the systems. So I always focused in local government. I thought it was the most exciting place to be, the most actionable place. So I've done most of my career in small municipalities in New York State. And I found that to be very, just very familiar and very good, in terms of my career path. But there are ample opportunities now in the public sector. We're seeing lots of it open up with respect to healthcare, and if you are in the healthcare track there in the MPA program, you have the flexibility of looking at 3 different sectors, because the public sector, private sector, and nonprofit all have healthcare opportunities. So that's a pretty interesting, branch to be able to take off of your MPA tree. You have different alternatives and places to go, but we're hearing that physician's assistants, home health care aides, information security analysts. I made a little list of what the Bureau of Labor and Statistics are saying are the hot jobs in the next 5 to 10 years. Data analysts, statisticians, nurse practitioners. So it seems to be, healthcare seems to be gaining lots of the job vacancies as people age and age out, and more needs are becoming exposed. Government goes through cycles. There's a lot of it's done through NGO work now with non-governmental organizations. There's a lot of partnerships. There's a lot of intermunicipal things happening. But then again, there still needs to be good management. So I think you're going to see lots of career opportunities open up in government administration, which I just think is just a terrific way, to have a public sector career if you can follow, in a municipal management track. With respect to being able to advocate for equity in these, with these opportunities, I am just extremely impressed with the level of social consciousness that not only private sector corporations are showing now, but also a lot of the public sector entities that I've worked in, particularly in New York State, making great strides in dealing with diversity, equity, and inclusion in the workplace, despite the civil service constraints that tell us we have to hire from a certain eligible list. 90% of our employees, we can't choose how we can, search or try to attract different talent, because we're stuck with some arcane civil service system. So despite that, there are, a lot of opportunities coming up where conversations are taking place in our organizations, where we are expanding our net to try to get more people interested in public service. I think that there's going to be, ample opportunity for people who want to work in these sectors to do so. without worrying about some of the institutional hurdles that were there in the past.
Thank you.
You're welcome.
And Ariana Anderson, sorry, but very quickly, can you see where your field is in the next 5 years, 5 to 10 years?
Sure. Growing. Healthcare is always needed. And especially serving veterans, especially with the current war going on in the Ukraine. The VA isn't going anywhere. We will be here forever to take care of all of those who have served. But the wonderful thing I would say about the Veterans Health Administration is that whether you are on a government track, a healthcare track, there's opportunity for all of you and anyone in the MPA program to find positions that will really make you feel empowered and like you are contributing to the public. Whether you're going to be an administrative officer, to being an accountant, to being a budget analyst, there's always opportunities. And also, of course, if you want to be in the clinical side as a business manager or go forward and become an actual clinician, endless opportunities. I would say the best way to expand opportunities to, I guess, a more diverse group of people is identify, again, I like the word identify, but identify, where's that demographic really going to school, and make sure that you're advertising your organization or company in those places. It's, sometimes it comes up, oh, it's not enough inclusion, it's not enough diversity. And the assumption is that, well, we're not hiring them, they're applying, we're not hiring. Well, we don't know. Are they applying? Is it being advertised? Do they even know that these opportunities are available? Because until we know that, we can't say that no one's selecting anyone. We have to make sure that they're first being advertised in a place where they can apply in the first place. So I would say advertising is key. And then once people start applying, best qualified, to make sure that you do have a wonderful assortment of everyone. And with race, with gender, but with age, as Patti said, you have a lot of the baby boomers who are leaving, and with them is going all this wisdom that they used to build these organizations and these companies and keep them going. And I will say what's wonderful about the Bronx VA, it's a wonderful combination of those who have been here and have created all these programs. Then you have those in the middle who have sustained it, and it kind of straddles between the wisdom and the new. And then you have the new people coming who are the innovators, creating all these new programs and systems rather. So you have to have a little bit of everything, I think, to make an organization run well.
Thank you so much. And just to end off, I think Professor Skatalniko's question is perfect. I want to ask both, what is the most important skill you think MPA graduates should have today?
Stamina.
That's a talent too. Important skill. I like to focus on the interpersonal skills. I think an empathic, a little empathy is important. And I also think that knowing what you don't know is a very important skill.
Great.
Yeah, I think a lot of us learned given today. So just to, I just want to say I think, you gave a lot of good advice. You covered a lot of what could be useful for future careers,
Mm-hmm.
I would say, I would definitely say, my professors have helped a lot. And I just want to say thank you to, both Skatalniko and Kalinda specifically for helping us through this entire ordeal and just prepping everything and getting us in contact with you in the first place. Just for people who are watching this, yeah.
Oh, go ahead, Dr. Skatalniko.
Yes, I just wanted to thank both panelists, and I do agree with both of you, and especially Patti. I think, yes, the soft skills, the interpersonal relations, they're going to be here. Yes, Ariana, regardless if we're going to use technology all the time, people are social human beings, where we don't like to be disconnected or apart for too long. I think today's events kind of reflect a lot of the obstacles we face in our work day to day. So you have to actually be prepared for the surprises and pivot, and make the best of it as you can. But I do appreciate both Ariana and Patti coming here today. And hopefully we're going to see you in person next year, when we're going to probably plan an in-person event sometimes in the fall if the weather is nice. And yes, it may be outdoors, it may be indoors, but we'll work on this. Thank you to all to Mornette, to Sydney, to Nino and Khalid for putting this event together. So I think we've been on a hiatus for the last year, and that's been a wonderful effort on your part.
And no, I want to shout out Samir, who's in the chat. Like, he's part of our new board. We've got something cooking up for May, so just keep an eye out for that.
Yes, we're starting. We're hoping to have one in-person event in May, even just a little social gathering for the MPA students, to kind of, after being on Zoom for so long, to kind of get to know each other in person. But I do want to personally say thank you to Ariana and Patti. I know we had some technical difficulties, but you show resilience with sticking through it and staying on. So I really do appreciate it.
Well, as
And I
vice
just want to jump
Ariana,
in.
pleasure meeting you as well.
Sorry.
Pleasure meeting you too, Patti. Oh gosh, and thank you very much for this invitation. It's always a pleasure of mine to be included in any PACE event.
Thank you so much for your participation. We really learned a lot today, even in a small amount of time, but we have learned new things. So thank you.